good afternoon, and welcome to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer for Montgomery County government. And joining us today, as almost every week, is Dr. Earl's daughter, who is the Acting Assistant Chief Administrative Officer, also Acting Health Officer, Dr. James Bridgers. And this afternoon, we have two additional guests joining us. We have Maryland Senator for District 14, Craig Zucker, and also Maryland Delegate, District 18, Al Carr. Reporters, all of you should have already permission to record. If you do not, please use the chat. And let's get started. Mr. County Executive, good afternoon.
Good afternoon. And thank everybody for joining us again for our weekly press briefing. I'd like to begin today's briefing by extending my thoughts and sympathies to the family and friends of Board of Education member Patricia O'Neill, as well as everyone in our Montgomery County Public Schools community. Her passing is a great loss for MCPS and our entire county, and her love of children was only matched by her commitment to the constituents she served for nearly a quarter of a century. We'll be flying flags at half-staff beginning today to honor her legacy. I want to start with our regular COVID briefing now, and today our positivity rate is 2.52%, and we have a case rate of 12.79 per 100,000 residents. Yesterday, we had 97 new cases and 10 hospitalizations, and the number of cases per 100,000 in the past 7 days has been 89.2. We're still in what is defined as the zone of substantial transmission, according to the CDC. According to the latest data, we currently have the lowest case rate in the state. Our state has seen overall decrease in cases as compared to last week, and most of the high transmission cases, as you can see, are in the more rural portions of our state. Our COVID-19 testing volumes continue to trend up. This is not a surprise, as many families are increasing their vigilance now that the kids are back in school. Statewide, schools are now tied with nursing homes for total active outbreaks at 87, and schools lead with the amount of active cases that are tied to outbreaks with 299. I was glad that MCPS has begun rapid testing in the schools this week, and they are reducing the number requiring close contacts to quarantine while awaiting test results. These are all things I know parents are going to be happy with. We continue to be cautious, and I think the data indicates there are good reasons for us to be cautious. The American Association of Pediatrics has said that there's a 230% increase nationwide among children. Children now make up 29% of all new COVID cases nationally, 27 in Maryland and 28 here in Montgomery County. And I just remember back to the early days of COVID when children were barely a blip on the radar, and that's not the case anymore. As we noted a few weeks ago, this school year was going to be challenging, and we called for patience and understanding and improvisation during these unprecedented times. I was an elementary school teacher myself, and I understand the challenges, particularly with contacts among the younger children. And I'm very appreciative that the schools have responded initially with abundance of caution. I have to say I have a sympathy for a situation where you could be overly cautious and some kids get quarantined who maybe didn't have to be quarantined, or you could be under cautious and wind up with more COVID cases spreading in the school community. It is a challenge to find that balance, but I think we are arriving in the right place. I will say, as a former school teacher, it would take a week or two to memorize all the names of the kids in your classroom. And I had faces to look at. And if people think about it, the teachers in our classrooms, particularly the elementary school classrooms, they haven't seen kids in many cases for 2 years, and the children were all wearing masks. So whereas in the old days now, you had a face to tie to a name and you could know where a person was, where they were sitting, and who was around them. Now we're in a situation where everybody has masks on, and the difficulty of associating a masked face with a person's name is just increasingly difficult. The schools will work through this, and they will continue to be more cautious and work on better ways of being able to track who was in contact with people in the classroom. But I think everybody has to understand that this is just one of those, challenges that comes with COVID of not being able to identify the people that you're looking at very easily. We will continue to work and support testing and COVID mitigation efforts with MCPS. They've been really good partners, and I've enjoyed working with them and Superintendent McKnight and her staff. Vax rates and transmission remain better than our neighbors because we continue to have the highest vaccination rate for all jurisdictions with more than 300,000 people. 74.4% of our population are now fully vaccinated, and over 81.9% has at least one dose. And that's our total population, including all of those children under the age of 12 who can't be vaccinated at all. Of the eligible population, those 12 and up, 87.6% of our eligible population are fully vaccinated, and 96.5% of this eligible population has had at least one dose. So it will not surprise me and shouldn't surprise anyone that if we will likely manage to get to 95+% of our population fully vaccinated. So this means we're only 3.5% from 100% of our entire population of our eligible population having at least one dose of vaccine. And we've come a long way over a very few short months. I'm also pleased with our 65 and older population that they are now 95% fully vaccinated. This is a population we prioritized at the beginning of the vaccines, and it's paid off. And we now must get prepared to provide booster shots. We've vaccinated so far 439 immunocompromised residents with third doses, and immunocompromised people are eligible right now. So if you do have reason to believe you're immunocompromised, you can come in and get vaccinated. In Maryland, in Montgomery County in general, we have 860,000 people with one dose, 780,000 people with two doses. We have 860,000 from the 12 years and up group. Those numbers would be the same. You can see the percentages on here. The 18 and older group, we've vaccinated 781,000, and 713,000 are fully vaccinated. And you see the numbers on the over 65 group. A number I want to highlight this week is that our Black residents are only 3% now below the white population in terms of vaccination rate. And this gap once stood as high as 18%. The Asian community remains the highest rate, having the highest rate of vaccination, and the Hispanic community is also above the white community in the rate of vaccination. Again, a tribute to the work that's been done by all our partners who are reaching out to folks in these disparate communities that make up Montgomery County. We are now in a transition period as we begin the search for our new and next health officer. Dr. Gales is certainly going to be missed. I appreciated working with him so much, and I want to thank him again publicly for his leadership, his calm demeanor, his commitment to science and public health, and for the courage to do what was right and recommend what was right, even though his other boss, the governor, didn't necessarily agree with what we were doing. Dr. Gales, I believe, always gave us the right advice and kept this county as safe and healthy as we could possibly be. But as Dr. Gales often noted, we have an incredible public health team still in place, and we've spoken to Prince George's County, and their health officer, Dr. Carter, will sign any of the medical orders that we need until we bring the new person in. We have a national search firm recruiting candidates, and the goal is to have someone in place as soon as possible. Dr. Crowell's on our call today, and if you have any questions about this process, you'll be able to ask him. This is Hispanic Heritage Month, and Cesar Chavez is quoted as saying, "Preservation of one's own culture does not require contempt or disrespect for other cultures." That is something that we try to bring to Montgomery County every day. It's important to recognize that the celebration of one culture is not a denigration of another culture, and that we all live in this space together. We have the opportunity to work together and grow together, and that's something that Montgomery County has prided itself on for a long time, and it's something we continue to do the necessary to work to make our words match what we say we believe. And we're going to continue to do that kind of work in the county. As we celebrate Hispanic Heritage Month from today until October 15th, I encourage everyone to learn the history and customs of our Latino communities, enjoy the cultural events, and appreciate the contributions to our county's past, present, and future over the next month. We are proud to be home to multiple generations of immigrants from every Latin American nation. According to the 2020 census, the Latino population in Montgomery County increased by 31% since 2010, and Latinos now make up 20.5% of the county's total population. Our Latino brothers and sisters are critical and vibrant in every neighborhood, every industry, and throughout county government. Montgomery County is the #2 destination among all U.S. counties for immigrants from Bolivia and the #3 destination for immigrants from El Salvador. I enjoyed kicking off Hispanic Heritage Month this past Sunday, September, at the 16th annual festival, Salvadoranísimo de Independencia, Salvadorian Independence Day Festival. And I look forward to more celebrations throughout the month. I also want to acknowledge that Kol Nidre is tonight and Yom Kippur tomorrow. This is the holiest day of the Jewish calendar and a solemn day for those who observe. And I hope everyone gets to observe this holiday in peace and ponders the importance of this day. Finally, I want to thank Senator Zucker and Delegate Carr for joining me today to discuss the looming deadline for the homestead tax credit. They, along with our entire Montgomery County State delegation, have been pivotal partners in ensuring that we're providing as much financial support for working families. The State Department of Assessment and Taxation administers these credits for low and moderate income homeowners, and the credits must be applied for each year. This year's deadline for applications is October 1st, 2021, only 15 days from today. It's an important deadline, and I'm glad they're joining me today to explain how important this is for the rest of our community. Last year, over 4,300 Montgomery County residents received over $5.6 million in the county supplemental homeowners tax credits. The average credit was $1,290, and that is a significant amount for many of these families. I believe we have more residents who qualify for the tax credits, but we must make sure they're aware of it. For more information, you can apply for the tax credits at the State Department of Assessments and Taxation website that we've put on the screen, and we will link to this in the chat. And I will now turn this over to the two representatives who are joining us here today. So again, thank you very much for being here, Senator Zucker and Delegate Carr, and the floor is yours.
Well, thank you very much, Mr. County Executive. I want to thank you for inviting us here today. I also want to thank Delegate Carr for his leadership around the homeowners property tax credit issue. Mr. County Executive, Delegate Carr, and others, as you know, this past legislative session was about providing recovery and relief for Marylanders, including Montgomery County residents, and that prompted the General Assembly, led by the Montgomery County delegation. That includes the Montgomery County Senate delegation, House delegation, teaming up with the Baltimore City delegation to find, along with the support of a constituent, an error in the way the State Department of Assessments and Taxation calculated refunds for two jurisdictions, Montgomery County and Baltimore City. And we realized that they were shortchanging Montgomery County and Baltimore City residents by tens of millions of dollars. And in keeping with providing recovery and relief this past legislative session, your Montgomery County Senate and House delegation went to work to right this wrong. When you talk about us going into Yom Kippur, we want to make sure that we're righting things that are wrong in the past and correcting mistakes, and this is in keeping with that. So it'll make my Jewish mother very happy. But we had gone ahead and passed legislation that was signed into law that will return specifically to Montgomery County residents more than $7 million. So what does that mean? That means that the State Departments of Assessments Taxation calculate, through the help of Montgomery County, calculate how much your gross income is, and then that determines what kind of property tax credit you'll get. And what they realized is a lot of Montgomery County residents were shortchanged, so we went ahead and fixed that. So over the next month, you'll receive letters. Montgomery County residents should receive letters, and you'll be getting a check in the mail proactively. You'll get a check in the mail by the end of the month, totaling more than $1,000. That is needed more now than ever. And then we also have this other looming deadline that the county executive alluded to, that on October 1st, anyone that wants to apply for the homeowners property tax credit should. And if you're 70 years and older, you'll automatically get retroactively get the credit paid back. So you'll get even more money. So we're urging people to apply. This is money that is yours. And we are glad that the Maryland General Assembly, with the Montgomery County Senate and House delegation, taking a lead with Baltimore City, is helped to make people whole, or as whole as possible. But we're encouraging everybody to apply for, qualifies for the homeowners property tax credit. If you're confused if you qualify, please go ahead and either check marylandtaxcredit.com or the State Department of Assessment Taxation website. But this is an example of Montgomery County government and the Senate and the House Montgomery County delegations working together to deliver for Montgomery County residents. And with that, I'll turn it over to Delegate Alcar.
Thank you, Senator Zucker. Thank you, Mr. County Executive. As both of you stated, the Maryland Homeowners Tax Credit, it's designed to give relief to low and moderate income homeowners across the state, especially for seniors. And Montgomery County has a very generous supplemental credit. It's separate and distinct from the county's tax credit for elderly 40-year residents. To qualify for the homeowners tax credit, your income for your household must be $60,000 or less. You do have to apply for it every year. About 5,000 Montgomery County residents received it in 2019. But as stated, there are more people who are eligible but are not getting the credit because they don't know about it. And so they're not applying for it. And the General Assembly has been working with SDAT, the agency that administers the credit, to increase the awareness. And as stated, the credit is more generous now than it had been in the past, because we did resolve that issue of the unrelated tax credits being improperly subtracted. The application is online, it's easy to fill out, and the deadline is October 1st. If you're 70 years of age or older, you can also apply retroactively for 2018 and 2019 in addition to 2020. So thank you very much, and happy to answer any questions.
Thank you, gentlemen, for joining us today. We'll get to the Q&A portion of this presentation in just a bit. And before that, let's toss it to you, Dr. Bridgers, for your update.
Good afternoon, everyone. Happy to provide a public health update again this week. In addition to the county executive update on third shots for individuals who are immunocompromised, we are vaccinating those individuals at home in that cohort of those individuals who have self-reported as being immunocompromised. But we ask, as always, that they consult their primary care provider, and we will be happy to support their need. Looking at the cases and hospitalization rates, just to add to the numbers this week, over the past month, we've had 3,591 cases. Those are cases that have been identified as post-vaccination or breakthrough cases. About 42% of those cases were breakthrough, and of that percentage, about 149 breakthrough cases were hospitalized. We still continue to see those individuals who are unvaccinated as our highest pool of those cases, 0 to 10 and 20 to 39. Most of the breakthrough cases have occurred again in those cohorts. And then we're seeing most of those individuals who are hospitalized being aged 50 to 79. More closely looking at the hospitalization data, we continue to monitor the data in collaborations with our hospital partners and looking at the not only the ICU bed capacity, but the acute care bed capacity and the surge bed capacity as well. We've only seen an increase of about 9 beds since last week, which is about 8.2, and a low to moderate utilization. We will continue to track those emergency room cases or individuals who self-report with respiratory illnesses, especially in children, or those pediatric cases, or those individuals that may have flu-like symptoms. And so we continue to monitor those trends on a daily basis. I'll stop there, subject to any additional questions.
Thank you, Dr. Bridgers. Dr. Stoddard, do you have opening remarks?
Yeah, just a couple. I want to start off by echoing the words of the county executive and thanking again Dr. Travis Gales, our recently departed health officer, for his partnership over the last couple of years. As he said to me on Friday, we were often seen as Calvin and Hobbes together, and I very much appreciated his work in collaboration with me. But I really wanted to just reflect on what the county executive said, and Dr. Gales said this as well in his parting words yesterday. It is a partnership, and so the team does continue to go on. Obviously, Dr. Bridgers, Dr. Kroll, and the entire public health team have been involved, as have I, since the very beginning. I can remember sending emails in January before we had cases in the United States looking at this issue. And so it's been nearly 20 months that I've been working closely with Dr. Gales and the rest of the public health team. And so while Dr. Gales does leave us, we have a ton of institutional knowledge that's been built over time that we expect not to miss a beat over the next months, and who knows how long COVID goes on for. I hope it's months and not years, but you never know. And so obviously, I appreciate his collaboration. The only other point that I was going to raise, and we spoke a bit about this yesterday in our 4 hours conversing with the county council, sitting as the Board of Health, we are focused both on the MCPS issues. We spoke at length about that yesterday. Happy to answer questions about that. But also we spoke a little bit about the employee vaccination record tracking. So we are working with our employee unions to maximize the opportunities for people in county government to make their vaccination status known. And obviously, once we have that status, that request for information goes through the 18th. We'll be able to in a better place to make decisions about how we do the follow-along testing and talk about increasing vaccination rates and other things of that nature. So we are working to get out to work sites to encourage people to sign up, to offer them computers or laptops on site to make it easier for people like bus drivers and others, corrections officers who are not normally in front of the computer, to get access and provide the information that we've requested. So that's all I wanted to say today, and look forward to answering your questions.
Thank you, Dr. Stoddard. Members of the media, I do not see any requests for questions on the chat. There's Steve.
Wait, yeah, sorry to cut in.
There you go, Steve. I see you now. Go ahead. I believe you have questions for the county executive and also for the members of the Maryland delegation. Go ahead.
Yes, ma'am. Good afternoon, everyone. About the tax credit, I know you just mentioned that there are people who are eligible but just don't know about the credit. Do we have any idea, and this could be any of the three of you, how many people in the county are eligible to receive it? I know, Mark, you kind of went over how many people received it last year, but just if anyone has any insight on how many people are eligible, that would be appreciated.
About 5,000 people receive it. In Montgomery County, residents receive it each year. I don't know off the top of my head how many people who are eligible but are not receiving it. To be eligible, your income must be $60,000 or less. But Steve, I could try to find that information and send it to you shortly after the briefing.
And we certainly want to make sure that people who have questions on whether or not they're eligible go ahead and contact the State Department of Assessments and Taxation and find out if they qualify. Because right now we feel like it's being a little bit underutilized, we believe. But the most important thing is that we refund the money that was shortchanged to Montgomery County homeowners, and also making sure that those people who are 70 years and older also take advantage of this and get the money that they deserve.
Thank you.
Okay. Next questions are coming from Karina Elwood, Washington Post, for the county executive. Good afternoon, Karina.
Good afternoon. Hi, I had a quick question. Thank you so much for doing this. My question was about yesterday in the county council meeting, there was some discussion about possibly mandating vaccine requirements for county employees. I was just wondering if you had any thoughts on that, or if we could see anything coming from that soon.
You need to unmute, Mr. County Executive, please unmute.
That.
Thank
I
you.
said I have a slightly mixed feeling about this in the sense that I do believe everybody should get vaccinated. I don't think there's any question that everybody should get vaccinated. And if I were running something that wasn't a critical enterprise, then I would take my chances on being able to find somebody who was willing to get vaccinated to do that job if somebody was unwilling. But I think there's some things in the county that we really have to think about. We could put this in place if the result is that large number of people in the fire department and the police department and our corrections decide they're not going to get vaccinated, and the county loses these people, the consequences to public health or to the public safety could be severe. And we've got to weigh that. And so it sounds simple. I mean, I get it. I'd like to do it. But I don't want to do something that produces an actual worse outcome than the problem we're trying to fix. And I think, a lot of people are, frequently in congregate settings. For the police and fire, a little bit less so. For the folks in the jail, they're definitely in a situation where they're around a lot of people, often a lot of the time. But I think we've got to consider what the implications will be if we're going to do a vaccinate or you no longer have a job mandate on those, particularly those three departments. I think it could be seriously problematic.
Great, thank you.
Thank you, Mr. County Executive. Brian Sears, Daily Record. I believe you have a question for the County Executive. Good afternoon, Brian.
Good afternoon. County Executive Elrich, I wanted to follow up on a statement that you made, I guess it was 2 weeks ago, regarding vaccination passports possibly in your county. Given your comments this morning about the high rate of vaccinations and your confidence that the county is going to get to 95% vaccination rate or maybe above for eligible population, does this in any way change your thinking on the necessity for vaccination passports in Montgomery County?
Not really. I mean, we have very fluid borders, for one thing. A lot of our county residents work outside of Montgomery County. A lot of people from outside Montgomery County work in Montgomery County. They come to the shops, the restaurants, the movie theaters. All the things we do here are attractive beyond the borders of Montgomery County. So because we know that this variant is more infectious and we know that we are having more breakthrough cases out of this variant than we did in other cases, I am trying my best to minimize the possibilities of additional outbreaks in the county. We've kind of been through this before where things seem like we're in a really good place and then a week later we're not so much in the same good place we thought we were in. So I would prefer to do this. I still prefer to do this as a regional thing. I think we're all safer regionally when we all do these same things together. But I continue to be concerned that I don't see anything but a benefit, particularly with, if you think about it in terms of local businesses. I can't think of anything but a benefit that a local business can advertise and say with certainty that the people who are in our premises or in or on our premises are vaccinated and that this is a safe place to be. I would like Montgomery County to have the reputation as this is the safest place to be.
As a quick follow-up, I know that you had discussed that you were going to bring it up with your colleagues when you had a phone call with them 2 weeks ago. My understanding from people who attended that phone call is that subject did not come up. Can you talk a little bit about why it didn't come up, and do you plan on broaching this subject with your regional colleagues?
We've broached it, and people are having discussions internal to their own counties. I'm trying to think which one. I think I read that one of the counties is actually thinking about this. I think other people are going to think about it the longer this draws on. But we also knew that, from pre-discussions with people, that there were people who were not ready to go there.
All right, that answer your question, Brian?
Yes, ma'am. Thank you.
Thank you very much. I do not see any more requests for questions.
Jordan
Remember-
Lindsay.
You calling? Oh, there she is. There you go, Jordan. Just popped in with my
Hi, thank you.
MCM.
Yes, thank you so much. Thank you. So I know yesterday, and this is for Dr. Bridgers, potentially, MCPS discussed quarantine guideline requirements updates yesterday during a meeting. I wanted to know if there are any trigger points or anything down the road that would, give any type of update in regards to what comes next for MCPS down the road.
Sure, Jordan. Great question. I'm just returning to the office today, and I'm having conversations with Dr. Kroll and Dr. Stoddard in collaboration with MCPS to see what those triggers are. We examine it. We've had multiple conversations on this forum and other forums about what the next steps would be. And so we are still unpacking that, keeping in mind that, there's no game book, no playbook for this. And we are looking at those public health practices to best inform those positive outcomes. So Dr. Kroll and Dr. Stoddard are on the call. They can add to that, but that's my understanding from our conversations and meetings this morning.
So thank you, Dr. Bridges. I would just say that our goal in all of this is to try to minimize the number of the risk of transmission inside the schools. And so one of the things we will be looking at are the number of positive cases that show up and the amount that and the impact that has on students and the need to quarantine students. If that rises, we will have to look at the criteria and the actions we need to take to try to keep those rates low. But for now, we are just trying to concentrate on getting keeping as many students safely in school as we possibly can to keep them on their academic path.
Great. Thank you very much.
Yeah, the only piece I agree with Dr. Kroll's assessment there, where it's a balance we're trying to strike. If we go too far the other way and we see more cases, then we may have to tweak the guidance. But the other piece I wanted to mention is we are seeking guidance from the Maryland Department of Health about the ability to potentially do a test to stay model, which would change the quarantining requirements yet again if we were able to do testing that would allow students who would normally be close contacts of a positive case to stay in schools. We've got to get some guidance from the state on that, and then we've got to work out the technical details with MCPS to allow something like that to happen. We would like to do it, to be clear, but we need obviously the support of the Maryland Department of Health, Maryland State Department of Education, and working with MCPS, trying to work out the logistics of that. So I just want parents to know we are looking at that. We are interested in doing it, but we got to make sure that it can work and that we're allowed to do it. So
Great. Thank you all so much.
Thank you, Jordan. Brian Rembaum with MarylandReporter.com. You have a question? You need to unmute, Brian. Please unmute. Thank you.
Can you hear me now?
Yes.
Okay, I just had a quick question for the county executive also about vaccine passports. I believe you said 2 weeks ago that this proposal could be before the county council, and I was wondering if there's a timeline on when that might be.
I don't have a hard timeline on it. I've seen this is in draft. We're still dealing with some other related issues, such as the state. So we are trying to make sure that if we put it in front of them, they're actually able to implement it. I don't want to put forward a policy and then discover we're not going to be able to get the information we need.
Okay. Are we good with that answer, Brian?
Yes, thank you.
Thank you.
yeah, I'll actually give some little bit more to that. And this is to the county executive's point. So the state of Maryland controls much of the data through their Immunet system for all vaccine records in the state of Maryland. While we know at the county level who the Montgomery County Department of Health and Human Services has vaccinated, we don't have access to all, well, we have access to it, but we don't have rights to the information that the state has. And so we've asked the Maryland Department of Health whether a system like a passport could access the database to, verify someone's vaccination status. And thus far, they have not been willing to support efforts like that, which have been engaged both in Montgomery County, but elsewhere in the state of Maryland. There are a number of counties that are interested in setting up platforms like that, even if they're not necessarily going to require a vaccine passport. They are looking to have systems that support businesses who want to implement their own passports so you can verify someone's vaccination status. At this point, therefore, the only mechanisms that are in place is if someone actually has a physical vaccine card or goes to, or they're vaccinated in the state of Maryland, they go to the My IR system, print off essentially a receipt of your vaccination record from that site. So in light of that, obviously, so we've been looking at those technical background pieces while, there has been language drafted to be considered for a vaccine passport before the Board of Health. And we've got to make sure that we've got all that, we have that accurate and functional before it's suggested to the Board of Health. So, all those things are going on in the background right now. And, we don't have necessarily a time frame for that, but, it's something we're looking at. And as I think I've previously said, obviously we're not looking to, if COVID conditions worse, we really are wanting to avoid having to do restrictions on businesses, gathering limitations and other things like that we had to do last year. And so the vaccine passport model is something that would allow us to potentially avoid having to do those things if COVID conditions get worse. And so that's sort of the context in which we're considering this policy proposal.
Thank you, Dr. Stoddard. Now, I do not see any more requests for questions from the members of the media, as we do every week, going once, going twice. I guess that's a wrap for this afternoon. Thank you for the guests. Thank you, everybody. Have a great afternoon and stay safe. See you soon.